We work with communities that have well-trained medical staff, educators, and farmers, and we provide the tools that they need so they can advance the care and services they're providing to their community. One of the really great things about the suite concept is that, in general, an exam room is an exam room is an exam room, no matter which country you go to. And we recognize that in some cases, our partners may have materials already on site, or in many cases require additional material. So we customize each suite for the project and based on the needs of the facility that it's going to. It's interesting that we work in more than 90 countries now, and this is true in every country that we work in. Patients come to the hospital or clinic and the doctor or nurse knows exactly what to do to help them. They simply can't do it because they don't have the right tools. Farmers know how to grow produce to feed their families and their communities. They don't have the tools to do it. And educators know how to teach, they know how to train. They can't do it without the right tools.
Because of a lack of economic capabilities, they lack the infrastructure. How could you purchase without money? How can you receive? How can you order? How can you collect in a logistics way what's needed in a particular room? All of those components that we have in a well-defined society like the United States, we have defined our infrastructure. That's something that's not available to many countries. Deeper into that IMEC suite is the realization that we've also done all the infrastructure work that's often lacking in the countries where we go. All of the logistics, all of the receiving, all of the materials management, all the strategic planning is all incorporated into those suites. So that's the power of the suite.
The idea behind the suites is that everything is packaged here in such a careful way that we know everything that's needed is packaged into that one unit. So when the unit arrives at the receiving facility, everything that they need is carefully packaged and easy to remove from the container and into the facility itself. We had a project in Cambodia last year, and we received feedback from our partner that the very first day of the hospital opening, more than 300 patients were seen. And that was all with IMEC suites that had just been received by the facility. We get pictures of the very first baby born with that equipment. And we know that for years to come, that is the clinic that this baby will go to and receive care, and will for years to come, and her own children will likely be seen in that clinic. Health, agriculture, and education. We provide the tools for those three essential services so that we can advance the entire community on an institutional level, a really substantial humanitarian global project.